Would you like to just start off by telling us a little bit about yourself?
Yeah, so I graduated. I originally wasn't even a nursing major. I started my college career as a film major, and then halfway through my freshman quarter, I kind of realized that I wanted a career that's more fulfilling, something that where I can make an impact in the world. And luckily, my mom and my brother are both nurses, so it kind of helped me transition my decision into doing something more fulfilling for me. The transition was pretty hard. I had to double up on a lot of like science classes, labs to catch up. But fortunately, it all worked out. I got into the program and I graduated, and it kind of just taught me that you can do anything you want as long as you put your mind to it. And though it was difficult, it was definitely well worth it. That I get to have a career now that I can enjoy doing.
Cool. I like it. It's like refreshing. It doesn't sound like too fake or pageanty or anything. Can you tell us a little bit why you'd like to work?
So for I think the values really resonate with me: the professionalism, respect, and then the diversity and excellence. That really resonates with me because I feel like there's a lot of the populations, and especially it's very diverse. And because of that, you're going to have a lot of backgrounds, a lot of socioeconomic status patients, a lot of sexual orientations. So I think it's important to have that respect toward all those type of patients, and to be in a hospital and have a culture that really emphasizes the importance of caring for all of those in need. I think that's important as well.
Okay. And can you please tell us a little bit about why you would like to work?
So I would like to work there because of their heart values. And that's the honesty, excellence, advocacy, respect, and teamwork. I think a big part is my nursing philosophy aligns with their view of patient care, as in Watson's care of nursing. So that basically means that patients shouldn't be treated as objects, and it has a more holistic standpoint of caring for them in their mind, their body, and their soul. And I think another reason why I would like to work is because of they promote diversity through, of course, it's area, and you come across all those type of backgrounds, but they have employee resource groups that promote the diversity. So for me, I would join the Asian Pacific Islander one and definitely be a part of it.
Cool. Can you please tell us about a time that you had a difficult patient and what was the outcome?
Yeah, so a time I would have a difficult patient would be, I believe it was the patient's family. Um, I walked in the room during my clinical experience for my experience, and then the patient's wife was yelling at the nurse because I just walked in there and saying that she didn't believe that the proper care was given. The patient was having emesis and he needed a scan of the stomach, but a lot of them was busy, so it kind of kept getting delayed and everything. So I think the important thing in that situation to deal with a difficult patient is to have leave room for open communication and education. So we kind of sat her down and I told her that everything was we're doing all that we can, and it's normal that it keeps getting delayed because of the emergency room, but we were doing everything we can that we promised that we'd do more or do a better job, and making them feel that we're not just forgetting about them. And I think another thing too is to just empathize with them. Of course, the wife's husband is in pain. He's having a medical problem that is not even diagnosed yet. So it's important to understand where they're coming from and to know that they just want what's best for their family. So
Okay. So this one, there are parts that I think were good, and then parts that I feel like could be better. The parts that I liked that you acknowledged that they're just trying to help, that you wanted to express empathy. The parts that I feel like could be stronger, when you say sat her down, it kind of seems like you're like, okay, you cool it. Like, you know.
yeah.
The other parts, just telling her we're doing all that we can. I feel like it'd be better to say something like that you had reached out, you assured her, how would you, so starting it, saying, leading up to like how you expressed what the problem was, and then saying that you recognize that she was just trying to advocate for her husband because he was in pain.
Yeah.
So you thanked her for her help, and you
Mm-hmm.
told her that you had reached out to CT or whatever it was, to try to expedite the procedure. And that they assured you they'll take her as soon as they can. And that if they don't take him shortly, that you would follow up. And then you tried to see what else you could do for the pain. I don't know if you like offered pain medication or you gave him like a heat pack or like distraction or like any, like, because sometimes with the anxious spouses, it can be helpful to give them something where they feel like they're helping. You know, even if it's just like a wet towel or like something where they're like, they feel like they're doing something, you know? So instead of like putting the kibosh on her freak out, it's sort of just like letting her feel like she's being helpful. You know what I mean? Yeah. If you were going to retell the second half of it sort of in that style, how would you do it?
Oh, it's like reset everything?
Reset. I mean, like, you can say the first part about like what the problem was, but then start with like the conversation with her.
Okay, so I think after sitting down with her, I would first hear her concerns and have the open communication and open, active listening to the patient and their concerns. After that, I would offer to follow up to see if they're still busy in the scanning process for the emergency room. And I would follow up with offering pain medications, and if they wanted their favorite song or music to be playing, I would offer that too as well. Anything to reassure them and hear their concerns for anything.
Okay. I like the part you said about like empathy before and like recognizing that she's just trying to help. I would for sure still say that part, and then say like that you thanked her for advocating and like thanked her for all of her help. They love that. The families, they love that stuff. Can you please tell me about a time that you had that you provided compassionate care or went above and beyond for a patient?
Yeah, so I think this is during my critical care experience. It was one of my first ones. I had a patient he had a rashes all over his body, very painful, very itchy, and he was crying when he first came in because he was an admit during my shift. And then it immediately kind of took a little toll on me because he was kind of the similar age as me. And as I was doing the assessment questions and when it got to the suicide risk, he answered yes to one of the questions where it said he wished that he could fall asleep and then not wake up. So immediately after that, I knew that I wanted to sit down and at least talk to him, see what he's going through, because I already can imagine that it was already painful for him in a physical and mental way. So after we did finish the assessment, I told my nurse, I'm going to go sit down with this patient and talk to him for a little bit because he seems like he's still in distress. And then after I heard his concerns about his body image, how he had a whole life ahead of him, he was in college and he had to put everything on pause because of it. And he felt like it was a burden to his family. And I immediately looked to his bedside table and I saw a Bible. And me, I'm a Catholic, so I offered, like, do you want me to pray for you? I would love to. And in my head, I've never done this before and it was outside my comfort zone. But I feel like in that moment, it was something that I knew he would appreciate and it would help him in a way. So I gave prayers, I gave him reassurance, talked to him, got to know him a little bit. And he was very thankful for that experience. And that's an experience that I probably wouldn't forget because I always realized that, of course, there's the physical aspect of caring for a patient, but there's always the mental aspect because in the hospital, they could be going through like their worst days of their life. And it's important to recognize that you should do everything that you can on top of the plan of care.
Okay, good. There's a lot of like genuine heart in that. And I can kind of like picture it as you're saying it. And I think leaving them with that feeling and like picturing him and picturing you there with him, like those are the, like, when you're thinking back to an interview, like those are the kind of pictures they'll attach to your name, which is good. Can you please tell us about a time that you made a mistake in your clinical experience?
Yeah, so this critical mistake that I've made during my experience was during my ICU preceptorship. I was on the floor with my nurse, and there was a code blue, and one of the patients that I didn't have, went into cardiac arrest, So all the nurses immediately rushed into the room, and then my nurse kind of threw me in there and said, "You're gonna start giving chest compressions." So I immediately hopped in there, and after the first nurse gave his set, I hopped in after, and after that, when the patient got stabilized and everything, my nurse sat down with me and said, "You weren't going deep enough." And I told him my thought process of how it was a frail, older, elderly patient. So I thought that you wouldn't want to go as hard or as deep because usually in any other intervention, you want to be gentle with things. But that was kind of the first experience for me to do something more vigorous and more stressful. And the only experience I've ever had before that was with a dummy. So every time I give chest compressions now, I always know it's 2 inches, no matter what. And I kind of use any critical mistake or any bad experience I've had as a stepping stone to, future success. Because anytime I'll give chest compressions now, I'll never forget that. And I know it's hard to be, or it's easy just to be hard on yourself. But at the end of the day, you're always going to be learning, no matter if it's your first year of nursing or like your fourth year of nursing. So I know that it's important to just keep my head in the game and always just keep learning and keep open mind. So
Don't change anything about that. That was perfect.
all right.
Love
I
that.
got you.
Can you please tell me about a time that you provided culturally conversant care?
Culturally conversant care.
So, like, they used to say culturally competent, but they're thinking like that kind of makes it sound like you become like proficient and you like don't need to keep engaging in like learning. So they're now the term, especially at UCSF, that they're using is culturally conversant. So what a lot of people say for this is like that they had a patient and they worked with the interpreter or like the patient's children or whatever to find out what their preferences are and be sure to pass that along in the report, whether it was like they only like hot water or they don't want ice or like they love warm blankets or like
Oh,
they have
I
like
see.
they really like rice and juke or whatever like their favorite or like I had a Russian guy today and I know he loves like salmon and mashed potatoes but like I know to call it pureed potatoes because that's what he calls it, like
Yeah,
you learn their preferences and it kind of helps like little things like that that's like tailored to their culture.
got it. I feel like I don't have any like life-changing stories with this one. It's kind of just more like
Just little things.
little things. Okay.
Yeah.
I mean, hmm. I mean, I think there's one time, maybe this is like when I first started nursing school. I had a Vietnamese patient, didn't speak much English. His family wasn't there, and he was complaining about something, but we had no idea what he was complaining about after we gave him the food tray. And then after that, we kind of got the interpreter in, and then to figure out what was going wrong. And then from that day, I kind of knew about this, but for him, it was like that. Some Asian cultures they don't like drinking cold water in the morning. So from now on, then I try to be more culturally conversant in a sense that to bring them not cold water, I guess something along those lines. I remember,
Yeah.
but
Or you could finish it up by saying that like from that experience it taught you to like while you're taking the food order like ask what their preferences are with that and
oh, okay,
how like little things like that you've found like you like to try to do anything you can to try to make them feel more at home or comfortable while
okay,
they're stuck in the hospital.
got it.
Yeah.
Okay, thank you. Sorry, that's a hard one for me.
Yeah, and you can talk a little bit about how like that's part of what you love about San Francisco or something like that too.
Okay,
That you get
got
to
it.
like learn things like that you wouldn't otherwise know.
Yeah,
Yeah.
got it. I'll make sure to
Um,
include that.
can you please tell me about a time you had to think quickly? So there's a bunch of different ways that they can ask this. Basically, I want you to give me two like critical patient stories,
Mm-hmm.
and like they might straight up ask it like, can you tell me about a time you had a patient that was critically ill, a time you had to think quickly, maybe a time you had to like make a change in the plan
Mm-hmm.
of care,
Okay.
and then other stories for like your second one like this, you should hit them with at least two visuals of you like feeling really comfortable taking action when things go wrong.
Hmm.
and then like escalating appropriately. The second one you could use for like a time you advocated for a patient, a time you had to think creatively.
Okay.
You know what I mean? Like pair it to something random.
Yeah. Okay. I think I have one for each.
Okay. Okay. Cool.
For the first one, I'll just do the plan of care one, or
Okay.
critically, I guess. But so I
Yeah,
think
who knows how they'll ask it.
yeah,
It'll
I
be
think one
different for each
time,
interview too.
okay. One time I had a patient. He was a diabetic, and he recently just had the amputation of his foot. He was on a PCA morphine pump, and they've given him all of their pain medications, but nothing was really working. And I forget, this may have been like my first year, and I was still learning about pharmacology. And I remembered from my pharm class that gabapentin could be used for phantom leg pain. So even the nurse like couldn't really figure out like what else to do because they've kind of given him all the different pain meds, the highest, and nothing's been really working. So I suggested to my nurse that would gabapentin be an alternative for this pain medication since nothing else has been working. And after that, after we checked back with him, after we administered the medication, he said it helped a lot. And on top of that, I would say I did like something small, as in like just put up his favorite music, just because I know that little things like that can ease the pain for a bit. So I think that's the time I would kind of critically think or a plan of care or changing the
Okay,
plan
that
of
kind of
care.
works. For that question, I'm thinking more of like a pivot, like someone was gonna go home, but then you escalated something. And it's like, whoa, no, we need.
Oh,
I mean,
okay.
I mean, technically it would work.
Okay.
This one is not really like a critical story. I wouldn't use this for critical. You could use this for like a time that you advocated for a patient,
Okay.
is what I would pair
Got
this
it.
one with.
Okay.
It's a good story. Um, for the critical one, it's like maybe you were there, like you initiated like a stroke workup, or like somebody had chest pain, or like someone's vitals were uh
Mhm.
dangerous, or
Okay.
like someone was trying to self extubate, or something where it was like, wow, this is really bad.
Urgent. Okay.
Yeah.
Yeah. So I was with this is like one of my last shifts for critical care. I was with a traveler nurse, and one of before we're like giving medications, we're scanning it by the computer, and then one of the medications like fell on the floor, and then he I was the one opening it, and then it fell on the floor, and then my nurse was like, "Oh, just give it anyway." And
Shady.
I was I
Shady.
was I was like taken surprised by it. I was like, there's no way like he's serious. And then but he was serious. And then I went to the charge nurse and I said, we just need to get another one. I didn't really call him out or anything, but I kind of just calmly just handled it and said that we need another medication. It just fell. So I kind of just took the initiative to make that happen since the traveler nurse did not really care. That's kind of I guess a time where I would take initiative for that sense, I guess.
That's a good like integrity one. I like that.
Yeah. Okay.
Remind me again, what was your mistake question? The compressions.
The
What would you
compression's
trade
not
this
going
one
deep
for?
enough. Huh?
Huh? Do I like this better than the compressions one?
Mhm.
Probably not. No, the compression one was better. Um,
Mhm.
maybe, a time you had a disagreement,
Disagreement.
or like a time you had to, yeah. I don't know. Keep this story in mind. We'll see if we can find something to pair it with. I
Okay.
like the story just because it shows like that you do the right thing even when no one's
Yeah.
watching. You know what I mean? Even if it
Yeah.
means going against someone who has like more power in the
Yeah.
what do you call it, in the organization than you do. But
Yeah.
yeah.